Thank you very much. Thank you to Peter and Mo and Andrew for inviting me to this meeting once again. Pleasure to be here. So I've been asked to talk to you about foam sclerotherapy and particularly why we like it so much. Just a bit of background first. We first started performing foam sclerotherapy in Birmingham back in January 2002 as part of the Varicose trial for VENOUS, a company who were trying to develop a commercial foam product. They're still trying to develop it. We treated about 30-odd patients with foam back then. Now in the UK we were always sort of brought up to believe that you can't really treat truncal varicose veins with injections. But we were so delighted with the results of that we saw with our VENOUS patients that after the trial finished we continued to use foam using homemade foam with sodium tetradecyl. To date we've treated around 3,000 legs with foam sclerotherapy in both the public and the private sector. Why do we like it? Well, it's very versatile. It's well tolerated by patients. It can be used to treat almost any pattern of varicose veins. About a third of our patients have had previous treatment for veins, usually surgery, and it's a fantastic treatment for recurrent veins. We can use it to treat pretty much any size of vein. We've treated some monsters over the years, patients who've simply refused to have surgery. We counsel our patients that with the big veins it's going to take longer to see the end result. There are fairly few contraindications to foam, and the contraindications that there are basically are contraindications for the other techniques as well. So deep venous occlusion, for example, or immobility or coexisting peripheral arterial disease. It's very well tolerated by patients. It's a very simple procedure. You don't need any of these fancy radiofrequency generators or laser machines. In fact, this is my foam kit. This is what I carry around with me. Apart from the ultrasound machine, this is all we need. It's all in there. Very portable. It's also a very complete treatment, so we don't need to do any adjunctive procedures. We can treat the truncal incompetence and the superficial varices at the same time. And in excess of 90% of our patients only require one treatment to eradicate all of their varicose veins. Patients are very happy at the end of their treatment. This is a paper that we published a few years ago in the European Journal. We asked patients about their expectations before treatment. They had very wide-ranging expectations. Obviously they expected the veins to look better afterwards, they expected their leg to feel better afterwards. But about 25% of patients thought that having their veins treated would also improve their relationship with their significant other, and thankfully we managed to achieve that. I don't know how, but there we did. Of course, one of the most important things about foam sclerotherapy is the cost. It's a very cheap procedure to do. You may be familiar with this paper that was published by Alan Davis's group a couple of years ago. Costs are outlined there. Alan thought that the cost of foam was around £430 per patient. With my simple sums, I think that it must be quite expensive to treat patients with foam in London because in our Birmingham practice it works out around about £125 per treatment session, and that includes the operator's cost. The single most expensive item that we use are the stockings. These are the stockings we use, VENOUS 7000s, and they work out about €48 a pair. And of course that means it's very affordable, which in the UK is very important at the moment. It's almost universal now that GPs have been told that they're not allowed to refer simple, uncomplicated varicose veins, i.e. C1 to C3, for treatment on the National Health Service. We can still treat C4 to 6 in Birmingham, but there are parts of the UK that we can't even do that anymore. So most patients now are having their veins treated in the private sector, and I think, as Case Viddens said earlier, the insurance companies are saying, well, if the NHS doesn't have to pay for foam, then why should we? So a lot of our patients now are self-funding, and the fact that foam is so cheap means that we can offer it, it's value for money and it's affordable. We offer a fixed price package for our self-funding private patients, which is roughly 1/3 of the cost of surgery and 1/4 of the cost of RFA or laser. That's all well and good. There are all good reasons to like it, but does it work and is it safe? Well, the National Institute for Clinical Excellence in the UK has examined foam sclerotherapy twice and has concluded that it does work and it is safe. They are currently about to embark on examining it for a third time. I can't see any reason why they're going to change their minds. With regard to our own series, we published a series in the Journal of Vascular Surgery a couple of years ago, which detailed 1,400 vein segments. It's very safe, very few complications. To date, we've treated in excess of 3,000 legs with foam sclerotherapy. We've had 5 DVTs and 3 pulmonary emboli so far. 5 patients have reported transient visual disturbance afterwards, all of which have recovered spontaneously within 10 or 15 minutes. We've had no deaths, no strokes, and no blindness. Just a quick word about sodium tetradecyl. Until now, as far as I'm aware, there are no products, with the exception of polydocanol in Germany, that are licensed for use as a foam. So we use sodium tetradecyl in the UK, which is the only product really that's licensed for use. Polydocanol is not licensed in the UK. A week or so ago, STD Pharmaceuticals, who manufacture sodium tetradecyl, got a license for its use as foam. So we now have, or come the end of the year, roughly, beginning of next year, we will have a licensed product to use for foam sclerotherapy in the UK. And I suspect that the rest of Europe will follow not too long afterwards. In terms of the durability, well, this comes from our JBS paper. Say there are 1,400 roughly vein segments treated, and we followed them up. It's relatively small numbers, out to 5 years at the bottom there you can see, but 80% of patients only required one treatment. There was no re-intervention at 5 years. We're currently in the process of calling back patients who had foam sclerotherapy between 5 and 8 years ago, and hopefully those results will be available in time for the spring meeting of the Venous Forum of the Royal Society of Medicine in London next year. Sorry. It's also a great treatment for ulcers. So in conclusion, I would say that given great care and attention, all of the treatments that you've heard about today can achieve good results.